My name is Holger Schünemann. It is a great pleasure to introduce you to the course on WHO guidelines and GREAT. This is Module 2, an overview of practical issues in WHO guideline development. It is the second of 6 modules. It is narrated based on slides, has separate quizzes, and you can go at your own pace by stopping the presentation when you feel it is necessary. Before I begin, here are my disclosures. I do not have direct financial conflicts. I'm co-chair of the GREAT Working Group and director of Cochrane Canada, and I sit on the board of the Guidelines International Network. Funding for this work is from the World Health Organization, but the views expressed are entirely my own. As I indicated, this is Module 2, providing an overview of practical issues in WHO guideline development. The topics that will be covered are the types of guidelines that exist, how it is done in a nutshell, the process. It includes scoping and questions and how that is done, who can participate, that is who in the process of developing guidelines, the type of questions and recommendations that are formulated, how an evidence review is integrated with the recommendation development, and how recommendations and other types of actionable statements are actually developed and how do they exist in the context. Finally, what rules are followed to make guidelines at WHO credible and trustworthy? Let me begin with the types of guidelines that exist. There are standard guidelines that are developed according to standard timelines and follow all detailed processes. There are consolidated guidelines that are typically a compilation of existing guidelines to complement an entire field or topic or area of disease. There are interim guidelines that typically have an expiry date associated with them. There are rapid guidelines that are done in response to an emergency or urgency, such as in 2007, the avian influenza guidelines, or during the COVID-19 pandemic, COVID-19 related guidelines. There are living guidelines. These are guidelines that are continuously updated based on emerging evidence. There are guidelines that are developed in collaboration with or entirely done by other groups that WHO may or may not adopt or endorse. And then there is adoption or adaptation of WHO guidelines to context-specific settings. What is the scope of the guideline? It relates to areas of practice or policy to which the guideline actually applies, the people and/or populations, including subpopulations that the recommendations may affect, the interventions, options, or approaches or exposures of interest, that is the priority topics, and the important outcomes, both benefits and harms that may actually result from an option or from an exposure. What are the types of questions that can be asked? In health, we typically distinguish background questions from foreground questions. Foreground questions are typically questions that lead to actionable statements and can be answered in guidelines through recommendations. For example, what is cervical cancer is a definition, a type of background question. Or questions related to mechanisms. For instance, what is the mechanism with which human papillomavirus causes cervical cancer? Is a mechanistic background question. It does not necessarily lead to actionable statements. On the other hand, foreground questions do lead to actionable statements. For instance, the question in women aged 20 to 60, should screening for human papillomavirus for cervical cancer be used, should lead to an actionable statement. Either do it, not do it, or the conditions under which it should be done or not done. We formulate foreground questions by clearly specifying the population, the interventions, the comparisons and outcomes of interest. For example, the question, what is the impact in women aged 45 to 49 years of organized breast cancer screening compared to no breast cancer screening on mortality, breast cancer incidence, breast cancer mortality, false positives, and so on, is a typical PICO or PICO question that can be answered through an actionable statement, a recommendation. There's a distinction between guideline topics, guideline questions, evidence review questions, and recommendations. To further talk about this, a topic, for instance, describes the general area of the guideline or the scope. That is, it could be, for instance, breast cancer screening and diagnosis as opposed to all of breast cancer care. The guideline question is typically a should question that includes the population intervention, comparison, and sometimes the outcomes of interest. But typically it's formulated without the outcomes of interest. That comes later. So for instance, should intervention or option A or B be used for people with X? Then there are evidence review questions that also specify, again, the population interventions, comparison, and outcomes. So for instance, in people with X, what is the accuracy of test A compared with test B? Or in people with X, what is the impact of A compared with B on outcomes 1, 2, 3, if we're talking about intervention questions? Or what value do people with X place on outcomes 1, 2, 3? That's a question about values or the importance of outcomes. In people with X, how cost-effective is intervention A compared with B? Or for instance, in people with X, when compared to intervention B, is intervention A feasible to implement? There are other questions such as prognostic questions and so on. The answers to these questions through systematic reviews typically lead to the answer to the should question, the recommendation, an actionable statement. For instance, in people with X, the guideline development group or panel recommends or suggests using A rather than B. This schematic shows the typical WHO guideline production process. It begins with the WHO department deciding to produce a guideline, submitting an application to what is called the Guideline Review Committee, GRC, which is either approved or sent back for a revision, then typically with advice and support from different groups, including expert panels, collaborating centers, systematic review teams, external experts. The guideline is produced by a WHO department, which can take from a few months to a longer time frame, and it is then submitted for approval before it can be made public, and additional relevant approvals are obtained at higher level. Obviously, there can be updates of such guidelines. This slide shows a more comprehensive overview of the guideline development process. It begins with good organization, budget, planning, and training of the relevant individuals involved, including the guideline development group, members, as well as experts and systematic review or other technical teams. What is important to note is that there is different groups involved. At WHO, the Oversight Committee is the Guideline Review Committee. The Guideline Development Group or Guideline Panel may include guideline methodologists, economists, other experts as necessary, but typically, obviously, experts in the field. The working groups include, for instance, the WHO Steering Group, which are typically members of the department that organizes the work, systematic review teams, technical experts, as well as observers that respond to the input from stakeholders and consumers, for instance, when priorities are set. Conflict of interest considerations are critical throughout the process, from priority setting to updating. And indeed, priority setting, such as Defining the scope of the guideline is the first step. That includes also selecting the target audience. This is followed by the development of the type of questions that I just described, typically with the guideline development group. That also defines or helps identifying the outcomes that are critical or important for decision-making. The guideline development group uses evidence that is typically summarized by systematic review teams and relates to effects such as from interventions or diagnostic tests that should relate to the importance of outcomes, including addressing underlying values and preferences, reviews that include baseline risk estimates, how big the burden of disease is, that inform about resource use and, for instance, effects on equity. They will then develop recommendations and determine their strength, word the recommendations. Recommendations are then peer-reviewed after appropriate reporting. They will be disseminated, typically evaluated, and updated as necessary. Final guideline approval at WHO typically happens after step 6 with a plan for peer review and dissemination, implementation, and evaluation and use. At WHO, the GRADE process is utilized. GRADE is a transparent and structured approach that helps us judge the certainty that one places on the body of evidence by addressing questions such as what are the limitations of the underlying research evidence or studies? Are the results consistent when they should be consistent? Are the results precise? How directly does the actual identified evidence relate to the population or setting, the interventions and outcomes? Whether or not it is all the research that exists or if there's publication bias, and if there are any issues that increase the confidence of a guideline panel. But this evidence is typically not enough. GRADE also offers a framework that is utilized by WHO to help reaching decisions and making recommendations by evaluating benefits and harms, resources, acceptability, feasibility, equity, as well as other issues, such as human rights, ethics, and so on. WHO also uses a framework that is called WHO or WHO Integrate. That has similarities with the framework that I described here. And as I indicated, for the steps that are here framed by GRADE, the WHO uses this approach, the GRADE approach here on the right-hand side. So a typical guideline would have the following anatomy. This is an example from the Global TB Department, where it is transparently described who participated in the guideline development group, the individual names, who was the external group, who was the systematic review team, external partners and observers, the WHO guideline steering group, as well as where funding was obtained from. And this particular guideline development group would use the following process. The guideline development group would formulate population, interventions, comparators, and outcomes questions. And it would define which outcomes are critical or important for decision-making using the GRADE approach as described here. And then evidence syntheses such as systematic reviews or also health technology assessments would be conducted, and the information is in this particular approach then presented as evidence profiles or summary of findings tables, as well as evidence to decision tables with a rating of the certainty for each outcome and a description on each of the criteria. Note that there are also other tools apart from the GRADE profiler, which is shown here, used by WHO to conduct this process. The guideline development group then makes a recommendation or a decision. It utilizes evidence to decision frameworks or evidence to recommendation frameworks that describe the factors or criteria that I already mentioned on the previous slide. It includes the benefits and harms of the options, the underlying values and how that then relates to the balance of the effects on benefits and harms, the required resources, cost effectiveness, equity, acceptability, feasibility, ideally based on research evidence and additional considerations that inevitably will be made by the panel or the guideline development group, and then the judgments. That leads at WHO to recommendations for or against, that determines the direction. And these recommendations can be strong or conditional, sometimes also called weak. That is the strength of the recommendation. And again, this information is then presented in guidelines, also newer tools such as recommendation maps that are electronic and interactive and facilitate finding and understanding of recommendations. The guideline would have an executive summary, typically, with the key findings, and then individual recommendations. These are all TB recommendations here on top, and a COVID-19 recommendation based on a WHO guideline. For instance, a recommendation may read, levofloxacin or moxifloxacin should be included in the treatment of multi-drug resistant or rifampicin resistant tuberculosis patients who are on longer regimens. You will see a certainty rating, in this case, moderate certainty, using the grade approach that I just described, following those domains that I mentioned, and a strength of the recommendation, in this case, a strong recommendation in favor. Similarly here, these are environmental recommendations or engineering recommendations to prevent tuberculosis, and here is a diagnostic recommendation, how chest imaging should be utilized in the diagnosis and management of COVID-19. Always linking to the information that actually led the panel to making a recommendation. And what is also made transparent are the individual judgments that a guideline development group at WHO actually makes on the basis or related to the criteria that I described. Values, the balance of the effect, resources, and so on, as already mentioned. That helps making recommendations transparent. It allows also to provide detailed information and the rationale for why a specific recommendation is actually made. This is from a guideline developed by the Global TB Department again, and it deals with whether or not computer-assisted detection or human expert interpretation of plain chest radiographs may be used. There's a justification, there's subgroup considerations that can be provided, implementation considerations, and for instance, issues around monitoring and evaluation, so that the recommendations are appropriately implemented and possibly updated as necessary. But they are not only formal recommendations. As you've seen, explanations are often presented as remarks. WHO also produces good practice statements that differ from fully developed recommendations. There's implementation considerations, tools, and tips, such as the ones that I showed on the previous screen. WHO may make research recommendations, and there will be some informal guidance included in guidance documents as well. This, of course, should be kept to a minimum. Most recommendations should be based on the transparent link to the evidence. So what rules are followed? A guideline development group is typically guided by one chair or two co-chairs. The chairs ensure that guideline development group members can present their viewpoints and that all relevant issues are discussed. The rules are that the conduct is respectful and efficient, that one achieves consensus in a neutral way through discussion or through voting, that conflict of interest declarations and management is done appropriately to achieve objectives and adhere to the agenda. There's a couple of tools that I would like to mention. One is a checklist for guideline panel chairs that guideline development group chairs can utilize to take a guideline development group through the meeting. It has different domains and facilitates, again, the process. And then there are tools such as the guideline participant tool that is available that helps guideline development group members understand what is expected of them and what are optimal ways of supporting the guideline development group, for instance, during meetings and so on. In summary, this practical guide on WHO guidelines delineated the types of guidelines at WHO, how guidelines are developed. I talked about scoping and questions and who can participate, the types of questions and recommendations, the evidence review and how it influences the recommendation development and what type of evidence reviews can be done. Talked about the recommendations and what rules are followed. Next are some quiz questions. Try to answer the question before I continue to the next slide. First question, which of the following guidelines are not developed by key organizations, including WHO? Standard guidelines, consolidated guidelines, interim guidelines, rapid guidelines in response to emergency or urgency, retrospective guidelines. The answer is retrospective guidelines do not exist. Next question. The guideline development group is supported by technical teams, for instance, systematic review teams that synthesize the evidence or provide other technical advice. Is that true or false? The answer is it's true. Technical teams typically support the guideline development process and are managed by the steering group at WHO. Next question. The Guideline Review Committee at WHO, or similar in other organizations, is responsible for that the WHO process is followed by a guideline development group panel. It supports in planning of a guideline. It facilitates approval of a guideline, or all of the above. The answer is all of the above. Thank you so much for listening today. You can reach me at the following addresses.